Good morning. Oh, you're right. I don't think I have any sound here.
And now, we bring you the following live press announcement from D.C. Mayor Muriel Bowser. Our regularly scheduled program will resume following the announcement.
Good morning. I'm Muriel Bowser, Mayor of Washington, D.C. I'm providing an update to district residents on the district's response to COVID-19. I'm joined today by Dr. LaQuandra Nesbitt, who is the Director of D.C. Health, Jackie Bowens, who is the President and Chief Executive Officer of the District of Columbia Hospital Association, and Veronica Sharp, the President of the District of Columbia Healthcare Association. So today we will continue to focus on vaccine, and our main takeaway continues to be if you are eligible to get vaccinated and you're not yet vaccinated, you need to do so as soon as possible for your own protection and the community's protection. We also want to continue to remind everyone that if you need a test, if you've been exposed, you need to get tested. And we provide at-home testing kits at locations throughout the District of Columbia for pick-off and drop-off of a free, easy-to-use home testing kit. So knowing your status is key to stopping the spread of the virus. Here you see, if we just go back for a second, these are library locations, by the way, in all 8 wards at 16 libraries. We also want to talk about, and I know that you have been following on coronavirus.dc.gov, and you can do so daily, the numbers related to COVID, and I'm going to ask Dr. Nesbitt to walk us through several updates related to infections.
Sure. Thank you, Madam Mayor. Today, as you can see, we have posted our data. That includes data through last week. Weekend data we'll post as an update today. Our daily case rate continues to rise, largely driven by the rate of transmission for circulating variants. On the next slide, you will see that our daily case rate at 21 is double the daily case rate we had this time last year, which is disheartening given that we have vaccines that are available that can prevent new cases as well as hospitalizations and deaths. Next, you'll see we wanted to be able to provide a better picture for our residents to support them understanding why getting vaccinated is so important. So at last week, we updated our dashboard to include another tab under the breakthrough cases tab where it shows you the cases that are occurring in fully vaccinated individuals versus unvaccinated individuals. And we've also calculated a daily case rate for both groups. You can see here that clearly the vast majority of cases occurring in the District of Columbia are occurring in people who are not fully vaccinated. Next, you'll see even more importantly, we continue to emphasize that vaccines have great benefits, including against the emerging variants, in terms of reducing the risk for hospitalization and death if someone acquires COVID-19. Here you can see that the vast majority of hospitalizations that have occurred in the District of Columbia continue to happen in people who are not fully vaccinated. And we have been fortunate to have not identified any of the unfortunate 45 lives that have been lost in DC since May. None of those individuals were fully vaccinated. So it's truly a tragedy when we have the opportunity to continue to prevent loss of life from COVID-19. As we've highlighted before, we often have some disparities in where our cases are occurring and where which racial and ethnic groups are impacted the most by COVID-19. We continue to see that our pandemic now is being driven largely by 18 to 40-year-olds. And we know that the vaccination rates or vaccine coverage in this population tends to be lower than what we have in our 65 and over population. And if you compare how vaccination rates compare with what's driving our pandemic, it becomes increasingly important to continue to protect our children who are 5 to 14. They tend to be driving our cases, so all of them who are over 12, age 12 and older, who have the opportunity to get vaccinated should. And we want to continue to encourage vaccination amongst our 18 and 40-year-old population because they are the ones who are keeping COVID around. Thank you, Madam Mayor.
Thank you. So and Dr. Nesbitt, if you can also speak to the FDA's or the
Sure.
CDC's most recent update.
Sure. So over the weekend, last Thursday, the FDA amended the emergency use authorization for the 2 mRNA COVID vaccines produced by Moderna and Pfizer. And on Friday, the CDC's Advisory Committee for Immunization Practices met to review that amendment and to make recommendation for clinical considerations, which were accepted by CDC Director on Friday. We want to be clear, this is an additional dose. It is not a booster that the general public has wondered if it's necessary for people to get a booster. This additional dose is recommended and now permitted by the FDA emergency use authorization for a very small subset of the population who have specific health conditions or a medical history for things such as a solid organ transplant, cancers undergoing chemotherapy, specifically blood cancers tend to have a higher risk for people not developing an immune response. And some individuals who have autoimmune disorders that require them to take medications that suppress their immune system. This is not intended for people who have chronic diseases writ large, and we are encouraging people to discuss, because anyone who has a condition for which this additional dose is recommended would be under a healthcare provider's care. So we're encouraging them to speak with their healthcare provider to make the decision as to whether an additional dose is appropriate, and there are many locations throughout the city where they can access that additional dose. Thank you.
Thank you, Dr. Nesbitt. So we want to talk a little bit more about young people and getting vaccinated. Youth who are 12 years old and older are eligible, of course, for the COVID-19 vaccine. And we have some special sites set up for them and some special incentives. So at Anacostia High School, Tuesday through Thursday from 11 to 7 and Saturday 12 to 5. Ida B. Wells Middle School, that is adjacent to Coolidge High School. That's this Wednesday through Saturday from 9 to 1 and again from 2 to 7. At Dorothy Height, and Benning Library is Tuesday and Wednesday. So all DC residents who are 12 and older can show proof of their residency, receive their first dose, and receive a $51 gift card. So in their prize locations, in addition to that, just for our students at Brooklyn Middle School, Sousa Middle School, and Johnson Middle School. So for more information, you can go to vaccines.gov, and of course you can follow up with DCPS. And since the launch of our youth incentives just a couple of weeks ago, 337 students have received the COVID-19 vaccine at these sites. 231 claimed AirPods, which are hot prizes among our students. And 106 students have received their $51 gift card, and all students are eligible for the $25,000 scholarship. We also will have pop-up vaccination clinics at our DMV locations in Southwest and on Benning Ridge, and the hours for those locations are listed above. We've extended those pop-up sites through August 21st. You've also heard that DC Health has offered at-home vaccinations for people who need it, and we will dispatch a worker to your home to administer the vaccine. Please call if you need to, 855-363-0333 to make an appointment. We also want to thank our community core, who you have seen around town. You've seen various social media ads, and you may have seen them at your door. They have knocked on over 160,000 doors, engaged almost 80,000 people, and more than 7,800 people in high traffic areas, and secured transportation for more than 300 people to get to an incentive vaccination site. And also part of that program are vaccine buddies, and vaccine buddies can help family and friends get to the incentive sites as well, and by doing so they qualify also for a gift card for every person that they bring, up to 11 people. And so far, about 1,100 vaccine buddies have helped 1,916 family and friends get vaccinated. So that's 2,000 people who we may have not seen but for the vaccine buddies. 8 vaccine buddies have earned $561 in the Visa gift cards by each helping 11 people get vaccinated, so which is the max. So please reach out to your family and friends. You too could be a vaccine buddy by helping people get to one of the incentive sites. So I also want to turn to Dr. Nesbitt to talk about another very important aspect of getting people in our healthcare system vaccinated.
Thank you, Madam Mayor. Last week we had the opportunity to come before the public and speak to the requirement for employees, interns, contractors, grantees, et cetera, of the District of Columbia to be vaccinated. Today we are announcing the vaccination requirement for district healthcare workers. So by September 30th of this year, all healthcare workers in the District of Columbia must receive at least 1 dose of a 2-dose vaccine or the Johnson & Johnson COVID-19 vaccine. This requirement applies to all licensed, certified, and registered health professionals. There's over 70 here in the District of Columbia. All emergency medical services providers, such as paramedics and emergency medical technicians. In addition to DC Fire EMS, there are approximately 12 private ambulance services in the district, and so this helps capture that population, who are often the first people that some of our residents encounter when they need to receive emergency or urgent care. And all unlicensed health workers in the district. So we all know that there are many individuals who work to support our healthcare system who are not licensed. These are folks who help to keep our hospitals and healthcare facilities clean, to make sure that patients have food to eat and dietary services, and even some of the aides that assist people in their homes, such as personal care aides, do not require licensure. So it's a very robust requirement, and it is necessary for us to ensure that we're creating safe environments in our healthcare facilities and in our any places where people receive healthcare, to help disrupt the spread of COVID-19 and to make sure that we can prevent outbreaks in these environments. So in terms of when the second dose is due, anyone who's going to be submitting an application for licensure, certification, or registration in DC should have proof of 2 doses of the vaccine. Any renewals for those applications should also provide proof of a vaccine. And as I mentioned before, the requirement for the first dose or the Johnson & Johnson vaccine is September 30th. And we'll continue to make sure that all of our health professionals and healthcare workers have the most up-to-date information regarding this requirement. Thank you.
And thank you. So we are very excited that we are approaching the first day of school. In fact, it's 2 weeks away. We want to remind all students and parents to have their immunizations up to date before the first day of school. In-person learning will take place every day with layered safety protocols in place, and more information about the latest guidance and protocols will be shared this week. We expect to have another update this Wednesday. And I think that's all we have today. Are there any questions? Yes, sir.
So if we could look at the mandate for healthcare workers, is there an option, as there has been in other requirements, that if they don't get tested, if they don't get vaccinated, they could simply get weekly testing for healthcare workers, paramedics, EMTs?
Sure. So the requirement under an emergency use authorization, an individual has to have an option while the vaccines are approved under EUA. Most employers, similar to the District of Columbia, offer or require testing for anyone who does not get vaccinated. For healthcare workers, we are not establishing at the city level a requirement that they be tested if they object to vaccination while the vaccines are all approved through an emergency use authorization. We do know that many of our partners, some of them here today, will be requiring testing for individuals who are not vaccinated by date certain. But let me be very clear. This is because of the emergency use authorization and the language in the emergency use authorization that requires people to have an option outside of vaccination. When that EUA is not what we're operating, as soon as one of the vaccines is fully approved, no one will have an exemption unless it is for sincerely held religious beliefs or for medical reasons documented by their healthcare provider.
Okay, so I'm sorry I lost you there a little bit. So paramedics, healthcare workers, they will or they will not have this option?
The city, Dr. Nesbitt, the health department that is issuing this requirement, will not establish a process for people to be tested and provide those test results to us. We are confident that our healthcare partners, some of whom who are here today, will create an additional layer of safety for patients that does require testing, and they will continue to monitor it. I think many of you know that our nursing home staff and assisted living staff and staff in hospitals have undergone weekly testing for several months, and many of them will continue to hold those practices in place for any employee who does not get vaccinated by September 30th. Once the vaccine is fully approved, which could happen before September 30th, the government no longer has to offer people an exemption other than for medical reasons or religious reasons.
Okay, so for the employees who are DC government employees that would be impacted, for the paramedics and the EMTs,
Great question, Mark. So paramedics and EMTs are covered as district government employees who work for fire and EMS. If they refuse vaccination, we announced last week that they will be required to undergo weekly testing. That is as their employer, which is different than a mandate that is issued by the government writ large. I hope that
I
helps.
appreciate that. So
Yeah.
could we ask the hospitals, I guess that's why you're here, what will be the protocol at hospitals for healthcare workers? Will they be required to get vaccinated, or will they have this option of being tested and doing that?
So Mark, they are required to get vaccinated, right? It's if they refuse vaccination, what is the recourse?
Thank you.
Okay, thank you.
So first, I'll go first. First, I want to thank the mayor and Dr. Nesbitt for their leadership. And the hospitals, as you may recall, in June announced that all hospitals were moving toward mandating vaccinations for all their employees, regardless of whether they were healthcare workers, for all employees. So certainly with this new mandate, we intend certainly to be consistent with that mandate, and will be working, each hospital on their own will develop what their compliance may be for those people who are not vaccinated during this period of time. And that certainly, testing would be included as part of that as an option. So we certainly intend to be consistent with that for all of our employees.
Okay, any other questions? Yes, Stephanie?
I have a few questions, but I'd like to start with the third shot that we were discussing here, the booster, quote unquote. So we've been hearing reports of people taking it upon themselves to just go and get a third shot. How is the city going to monitor and make sure that it's people who absolutely fall into the category of, should get it, are getting it?
Right, we can't. I don't want to mislead you and have you thinking that there's any state who can actually do this, and this is why. We know that the FDA has amended the emergency use authorization for a very specific group of individuals as of Thursday. Last week, the CDC made it very clear that over 1 million people in the U.S. have already, using whatever duplicitous means they can, presented to healthcare providers, presented to pharmacies to receive a third dose. And we know that because of our state immunization registries and other databases that we share with the CDC. So they can see LaQuandra Nesbitt had 2 doses. If I get another dose, even if I present myself to a pharmacy and say, I'm starting the series or I just want to start getting vaccinated, we will know that it is your third dose at some point. Now, what these registries do not have, they do not have any of your medical information in it to be able to sort some person who is acting outside of the approved use of the vaccine versus someone who is acting inside the approved use of the vaccine based on their medical history. So there is no way for us to be able to determine. It is incumbent upon healthcare providers to provide the right type of guidance for individuals so people no longer continue to present inappropriately to the healthcare system getting a third dose when it is not recommended or required for them. And healthcare providers who knowingly do this are using it off-label, and there could be liability and consequences if a person is injured.
Another question too here, with regard to the vaccine passport, Mayor, I know you were asked about DC specifically, but there was talk of a meeting on Friday with a regional effort there. Can you tell us, did anyone from DC participate in this? And if there's a holdup, what is the holdup of a regional vaccine passport?
I don't have anything to say about a regional vaccine passport.
Would you be supportive of one?
I don't know.
Okay.
Yes.
I'm still a little confused about the healthcare vaccine mandate. Can you tell me, is this statement accurate? So they can healthcare workers can opt out of this until, Pfizer or Moderna gets full authorization, and then they can't.
That statement is correct.
That statement is correct. And how did you decide, what went into this decision to make this requirement for healthcare workers? I mean, what metrics, what other professions are you looking at? Last week, you said charter school workers, for instance, those are not city employees, so you're not going to mandate them to get the vaccine. So why healthcare workers, and where do you see your power over private workers?
Yeah, so Perry, this is a great question from a civics and government perspective, right? So the DC Health, the health department, through its 19 health professional boards, oversees 72 health professions. We also regulate healthcare facilities and places where people receive care. So I have the ability, the authority through the Communicable Diseases Act to make modifications to reduce the transmission of any infectious disease. It is under that authority by which healthcare professionals and healthcare workers in the District of Columbia are being required to have a vaccine. It's not unprecedented. These things occur from time to time in some jurisdictions related to annual influenza vaccine, et cetera. To make the point even more clear, we know that healthcare providers have some of the most direct contact with individuals. Transmission risk is higher during healthcare encounters if people are not using the right type of personal protective equipment. And we all saw what happened last year during the peak of the pandemic when healthcare workers themselves were succumbing to the infection because they didn't have the opportunity for protection with the vaccine. They can also be vectors for outbreaks to occur in healthcare facilities where people are living, in our long-term care facilities, in our hospitals where people are for longer than 14 days. So we want to make sure that we are emphasizing the importance under the authority of the DC Health to be able to ensure that these healthcare workers are moving us in the right direction as a city, but also as a region, because many of them are not DC residents.
So you have the power to do for any private sector worker, and you felt this one rose to the risk to do that?
To be clear, there are laws that govern certain things for which I have the authority. Can I today say that any taxi driver or shared driver has to have a vaccine? The authority extending to that is not as clear, but this is extremely clear in terms of my authority.
Right, and they're all, to answer your questions about our thought process, there's those things that are legal and practical, and all of the considerations that we make have, consider the entire context. Yes. Go ahead.
Question,
Uh-huh,
sorry. Me?
uh-huh.
Question for Dr. Nesbitt, too, if you don't mind. What are your thoughts on a regional vaccine passport? Do you think that would help in the effort?
I don't think it would help. I spoke about this last week, right? So there's no company who has developed it, and whether or not the government should continue to put resources and invest in technologies that are going to be short-term and have little utility long-term are absolutely debatable. Because there is no company that currently exists that has the ability to validate in a way that doesn't compromise privacy or protected health information, none of these companies are actually validating that people have been vaccinated. So you run the risk in establishing a passport that is not really tested in terms of its accuracy, its ability to validate status, of having people believe that they're operating fully vaccinated environments, and they're actually not, because people can trick these apps and they can trick these systems. What I believe is a more appropriate strategy is one that we're taking today. And it's one that people have the authority and employers have the authority to do under the mayor's order, which is to require employees in the District of Columbia to be vaccinated. That is low-hanging fruit, in my opinion, and the more employers that move in that direction, the higher we will see our vaccination rates go, not only in the district but in the region.
And then following up to that, with information in regards to those unvaccinated versus fully unvaccinated in deaths and COVID cases, is the city going to be showing, first off, underlying health conditions? And then in terms of not fully vaccinated, are we talking about then some folks that may have gotten one shot? Or are you saying it's safe for them to also just go out, and even if it's months after, to get that second shot?
Can you repeat the last part of your
So
question?
we're talking
'Cause I'm
about
not sure
the
I
maps
get
here,
that.
the graph
Not
behind
that.
you here.
No, not that. I get that. The last part of your question, you said something about people who only have one shot and then they go out
Sure,
or something.
if
Should
the
they get
category
their
is not
second
fully
shot?
vaccinated, does that include the people who only had one coronavirus shot and maybe didn't go for the second one for whatever reason? Is it safe for them now, if they got the first shot like 3-4 months ago, to go ahead and get that second shot?
You can always get your second shot, but I think we've been very clear that in order to be fully vaccinated, you must have 2 doses of a vaccine series or 1 dose of Johnson & Johnson, and you are considered fully vaccinated 2 weeks after that last dose. So that's very clear. We want to make sure we're explaining that to folks on our website. In terms of whether or not there's a demographic profile for folks, you can see here, the actual slide isn't here because it's a snapshot, but if you visit coronavirus.dc.gov, you'll see more information about the demographics of who is having a breakthrough infection. So I encourage you to go and visit that part of the webpage.
But
now,
underlying-
let me finish. So our ability to speak to underlying health conditions depends on the number of breakthrough cases. We have, as you all will recall, suppressed data from time to time when the numbers are so low. So thinking through whether or not it's meaningful to say yes, has a chronic condition, no, doesn't have a chronic disease rather, it is not necessarily a process that lends itself to anything intuitive. There are some chronic health conditions that people have for which their risk of severe illness is not documented, or increased risk of hospitalization and death is not documented. So someone having just a chronic disease and being a breakthrough case would have to depend on what those conditions are. Our ability to sort out all of those conditions without doing things that could, through a host of means, help people identify who some of these folks were. We're not in a position yet to do that because, fortunately, we have not had a substantial number of breakthrough cases.
Perry?
The DC auditor is out with a report today saying that the asymptomatic testing program in the spring in schools fell short of its goal, testing only about 4% of kids that were in person as opposed to the 10% that you said was, the city said was the aim and the CDC recommends. My question for you is, why did this program fall short? I know it had to do with, you only tested 10% of people with consent forms, right? As opposed to 10% of kids in school. So why did this program fall short? Do you feel asymptomatic testing in schools was effective last year? And how do you plan to improve on it this year?
I think you answered the question, Terry.
Yeah, but why?
If parents don't consent to having their child tested, they can't be tested, right?
but-
So you can set whatever goals you would like. If people don't consent, we cannot go into the school and test their kids. And even with the number of students who were attending last year, doing 10% or 100% of kids who submitted a form still didn't yield very high numbers. So I think we have to be very careful about looking at a number that says 4% of the in-person learners, and more focused on looking at how many people for whom did their parents consent. Now, it's also important to note that we do think this is a good idea. It's going to continue to be in place. When students return in person, some already have returned in person. DCPS opens on the 30th. The mayor has mentioned that there'll be additional updates relating to all of the things that are in place in those schools next year. But in order for it to be as successful as it can be, people have to consent.
I think, let me just emphasize what Dr. Nesbitt said. I haven't had a chance to see the report you referred to yet, but we certainly will. Our teams are meeting daily about the opening of schools, making sure as all of this information, some of it is new and breaking every day, and that we're incorporating that into our opening guidelines that we'll share with teachers and parents. So Dr. Nesbitt is 100% right. We want the whole school community participating, just like we want every eligible adult and child to get vaccinated. We want everybody participating in our testing program. But more than that, the testing program lets us know when there's been an infection. We want parents to think about their activities, to remind their kids about masking, and do everything that they can do to keep their family, their school family safe, so that we can have uninterrupted school.
But, thank you. And to follow up on that, but why, if the consent forms numbers are so low, why not test a bigger pool of the people that have been consented? And my understanding is that the consent forms haven't been issued yet to parents, and school's 2 weeks away. I mean, is there a plan to try to get the number of consent forms up?
Oh, yeah. So we will, and it is not unusual for us to be communicating to parents about opening of school and guidelines and things that they need, everything from school supplies to immunizations to what the COVID safety protocols will be. So that's ongoing. And I am quite sure that DCPS is emphasizing the need for consent forms. But it's just not, I don't want this to sound like a top-down discussion. This is a discussion among school communities as well. So parent-teacher organizations, the homeroom moms and dads who are working with the teachers, all have a role to play in talking to each other about the classroom, about after-school activities, about team sports, and how they're going to be safe. I think we would be really missing an important opportunity if all that we're talking about is DC government sending out a consent form. We're missing it. We're totally missing it. We need to be talking to each other as a community about what should be our top priority: opening schools safely and keeping schools open. And that's a conversation not only from us, but it's a conversation amongst us. And that's everybody that has to do with children being in school.
And just to make sure, when you say this conversation that needs to happen, do you have any indication that parents don't want their kids tested, or that they just don't know about the consent forms, or they didn't turn it in?
I think that all of those could be true, and I can't like estimate which one is more true. So our job is to get out there and make sure they have the forms that they need, from emergency contacts to immunizations to all of those things have to be submitted. And I don't think 2 weeks out, I'm willing to say that parents haven't done something they're supposed to do. Yes.
A couple follow-ups for Dr. Nesbitt. Dr. Nesbitt, you had mentioned on once one of the vaccinations becomes fully authorized, that then you would have the authority to require it without an option to opt out for testing. Is that your intent to do that with
Yes.
So that would be for the people we've already seen, DC government employees and healthcare workers?
That is for healthcare workers. The DC government requirement falls under the city as an employer. I am not the requirer for DC government employees.
Okay, so it would only be for those people who are licensed or come under your authority as the director of the Department of Health.
That is correct.
And so if, say, Pfizer became fully authorized, your intent then would be to require every healthcare worker to be fully vaccinated with Pfizer?
That's correct, unless they have a medical or religious exemption.
Okay, and then can I ask, you also said that it was low-hanging fruit and the clear authority that you had over the healthcare workers, you said it was less clear for people like taxi drivers and whatnot. Are you currently exploring what your authority is with an eye on the possibility of further extending these requirements to people like, I mean, I'll let you fill in the blank what type of other occupations you'd like to see.
Sure, so as has been the case since March 2020 and before, we are always looking at not only what our authority is, but what it is reasonable to do that will yield some public health benefit. So we'll continue to do that in the days, weeks, and months ahead. But it has also been very clear, and it's outlined in mayor's orders, in terms of the private sector's ability to require these vaccines for their own employees. Now, if you want to get into the discussion of, but what about the gig economy? What about XYZ? They can establish conditions for receiving their services, being in their venues, acting on their behalf. They have the authority as businesses, as private entities, to do those things.
So what businesses, what occupations would you like to see?
I don't have a better answer for you than that to tell you what's coming down the pike, if anything, in fact, is coming down the pike. My plea that I'm making is very clear. We've acted on healthcare workers. We have great partners in our healthcare providers, our healthcare organizations who are moving down this road, and we're going to accelerate that pace. This provides them some additional authority or strength behind what they are doing as employers. And any private sector entity, any business has the authority to require vaccines as a condition of employment and as a condition of utilizing their services.
And then my last question, can I ask about hospital capacity? We're seeing stress on hospitals around the country.
Sure.
I'm wondering what you're seeing here, particularly with pediatric. And are you seeing an increase in pediatric cases being hospitalized? And is that if so, is that putting a stress on our capacity?
Sure. So we'll note that we were extremely fortunate in the District of Columbia to not have to ever use our alternate care site and to not have to rely extensively on some of the surge capacity that was built into our hospitals and healthcare facilities at any point during this pandemic. While our hospitals' utilization, the number of beds being used, has gone anywhere from the high 70s to the high 80s over the past year. The proportion of people in the hospital due to COVID remains low. And so that's an important thing for us to be able to emphasize. In terms of pediatrics, we have not heard of capacity challenges with our pediatric hospitals or their ability to revisit their surge plans if necessary. What is happening across the U.S. in addition to COVID is that there's been an increase in children admitted for RSV, which usually impacts us in the fall and winter. With the degree of social distancing, mask wearing that most jurisdictions had in the winter months last year, we didn't see these large surges of RSV into our hospitals. Now, as parents are moving around with their children more, they're doing more travel, children are engaged in more activities that doesn't have social distancing, we're seeing and that same winter increase we've historically seen happen in the summer for RSV. And we see more kids who are requiring hospitalization for RSV in the region.
Thank you.
Okay. All right, last ones. Perry?
Are you guys considering any new restrictions, like indoor restrictions, as we see these cases continuing to rise like we previously had? And curious if you can talk about if you're seeing any clusters of cases. Can you, like certain neighborhoods, I know unvaccinated is driving these new cases, but any neighborhoods or new clusters you've been seeing?
We don't have any thought about further indoor restrictions at this time. We are committed to our masking as a way to stop the spread indoors. And clusters, you want to speak to any
Sure.
experience with clusters?
We update our outbreak data, so we encourage you to look there. That gives you some idea as to whether or not we have seen a cluster in any particular sector in the District of Columbia or employee type. We also advise people and want people to know very clearly that the places we are seeing cases geographically align with the places where vaccine coverage is low. So you can continue to see that data, the cumulative data for where we have cases in the district, and you can also see where vaccine coverage is low in the district, and there is a correlation.
Okay, yes, ma'am.
I know there was a discussion at one of the last meetings about social distancing within the schools, but for the parents who are concerned about young kids taking off their masks to eat and gathering together, can you just go over what is, a safe distance that you?
Yeah, we would, and if you could bear with us, we will talk about all school guidelines on Wednesday.
Okay.
Okay.
Can I follow up to then with the dashboard? Is the district going to identify the schools? I know you have the number of DCPS workers and whatnot, but are you going to identify the schools that are involved? And any information, anything you would say to those parents who have kids in charter schools who are concerned? There is at least one charter school right now that's been sending emails from different campuses confirming positive cases of students on their campuses. What you would say to those parents who are asking, when might the health department come in and do something about it?
Let me just say, we last year have a system, I think that includes all the schools, DCPS and public charter schools. And we, Dr. Nesbitt will remember this better than I am remembering it right now, of exactly what we report per school.
Correct. So on our outbreak dashboard, there's a K through 12 schools tab. And you're able to see how many of our cases are happening in public schools, private schools, parochial schools. We also list, because again of this data suppression piece, we list the total number of cases in that school, in schools, I believe where the number might exceed, it's either 5 or 10. So we'll continue with that practice. It's very important for families to be engaged as we prepare to reopen school and prepare for our students to be back in seats with our DCPS system on August 30th and some other schools that have already started, is to make sure they understand what the process of communication will be from their school leaders. DC Health does not reach out to parent or full school communities as part of our work. We conduct contact tracing in partnership with our schools partners, but any information that they should expect to receive about any school having 1 case, 5 cases, 10 cases, that will come from their school leaders and their school communities. DCPS has a clear process. They'll talk about that process later this week to give you all details, but the health department does not issue letters to schools. And Stephanie, to clarify and to make sure everybody understands, DC Health investigates cases and outbreaks, okay? And anytime there's an outbreak, we'll make a decision about how that's mitigated. I don't think that people can expect to hear from me that there's a magic number of cases that has to occur in order for a classroom to return to virtual learning or a school to be closed for all students for a period of time. Our investigations lead us down that road.
Okay, thank you, everybody.